Can you see well?
I can just adjust it. There we go.
See? So, and this is a model for a 36-year-old patient with a colorectal liver metastasis that presented with a colonic obstruction, with a colon tumor in the stigma, and metastatic to the liver. Before we move forward to surgery, you can see the anatomy here, and then I'm putting it back so we look from the front, and we can see the cava here, and we can see the left hepatic vein. The middle hepatic vein goes here behind the tumor, and the right hepatic vein goes behind here. I can show you that also from this slide. So if you look at this, what would you guess will be the transection that we will need to do for this patient?
So the middle hepatic vein is involved in the tumor. So that's going to come in our resection, whereas we're going to preserve the left. So I would think like you would have done a extended right hemihepatectomy.
Exactly, taking the middle, right? Yeah. Okay, do you think the portal vein here is going to be okay?
Yeah, I can see there's a good margin, especially so what I would worry about is the left, right, the left portal vein. And there will be good margin away from the tumor.
Exactly.
Oh, this is a great model. You're having fun playing with this? That's a nice view of the right hepatic vein, the vena cava down the middle hepatic vein, the left hepatic vein. And I don't know if you've been in the OR much, but they always talk about the groove. So the right middle groove is that groove in between the two veins, and then the left middle groove in there. And they're just important because you need that little groove. If you're going to cut that vein, you need to have that little groove on both sides so that you can staple it or cut it. Or Greg used to talk always about this branch here, which is he calls the comeback branches of segment 4, because the sort of left vein comes out and then it comes back. So his sort of way of talking about that, because that's the blood supply to this part of the liver in here. So he would always talk about the comeback branches of segment 4.
So when they're doing a right hepatectomy,
I
guess they go they go this way. They start dissecting here.
Yeah.
And then you will take the middle vein as well?
You can do it either way. Usually we try and leave the middle vein with the bit that's staying, with the remnant. And you have to remember as well, when you do a hepatectomy, even though that's your view now, we always retract the liver up. So the liver almost sits like that, basically. When you're doing the operation, you get this view. And so you're approaching the porta this way. So usually you'll take the portal vein first, and then that helps the liver to open up. And then you'll come down. And then exactly as you said, what you do is you run into that fork there where my finger is. There's one vein that way and one vein that way. So you run into that fork, and then you have to make a decision. If we're going to keep the middle vein with the remnant liver, you cut through that way, and then you're on this side of the vein, and then you follow down. If you're going to take the vein, so in this case, because the tumor is pretty ugly, the vein will be going with it. So you'll come onto the middle there, and then you come this way, and then you go along the middle vein on this side.
That's very interesting. Thank you very much for the class.
No
crazy. I'm receiving lectures from Australia.
It's good, isn't it? Bring in teaching sessions. This is great.
Yeah, it's crazy.